All right, so primary hypertension, or another term that you might have heard, is essential hypertension. Pretty much that's a gradual development of hypertension over the years without an identifiable risk. Secondary hypertension is a result of another medical condition. And with primary hypertension, the development can be due to multiple different pathophysiology aspects. Genetics is a huge aspect of the diagnosis of primary hypertension. Other bodily issues that can cause the primary or the development of primary hypertension is overaction of the renin-angiotensin-aldosterone system. Other causes include excessive response of the sympathetic nervous system, endothelial dysfunction with a decreased production of vasodilation mechanisms, and sodium sensitivity. Secondary hypertension is more based off of a result from other medical diagnoses such as sleep apnea, Cushing syndrome, or renal artery stenosis, to name a few. So. The solution to secondary hypertension is to treat the primary cause to control the hypertension. And you may have to add on additional medication to help control the hypertension still. So complicated hypertension, which is the most severe out of them all, and we're reaching a level where there's no reversal at that point, is also malignant hypertension, and it is extremely high blood pressure that comes on quick and is associated with complications such as organ damage or even failure. The cause of this stage of hypertension is due to noncompliance, kidney disease, endocrine dysfunction, amphetamine use, central nervous system disorders, or coarctation of the aorta. The criteria for this class of diagnosis of blood pressure is a systolic blood pressure greater than 180 and is sustained, and then is an emergency and should be treated as soon as possible. So this is a scenario that if you find that your blood pressure is greater than 180 systolic, then you should be going to the emergency room and getting it treated immediately. But that level could be avoided completely by, managing before it gets to that level. So the history that Mr. Jones presents that is significant information related to the hypertension is his lifestyle has a significant risk factor to the continued risk of hypertension. Mr. Jones is already diagnosed with hypertension, and based off his history, it is not controlled. So definitely questioning Mr. Jones about his control of hypertension, if he takes medication, if he even monitors it frequently. Genetics is already a significant factor associated with him, since his mom and dad both passed away from complications relating to hypertension. So genetics is not a factor. So in this case, it could be Mr. Jones's case. It's definitely environmental and genetics factor together. So the other thing I want to question is the question of lifestyle growing up. It is assumed that with genetics, not necessarily inheriting it from the parents, but growing up in the atmosphere that your parents grew up in, and you inherit the lifestyle that your parents raised you in. So what is his home life like? His environmental factors. What is his dietary consumption, his exercise, and his exposure to smoking growing up as well? So the things I'm going to focus on for Mr. Jones are the lifestyle factors that were given in his history as HMP. So the first lifestyle factor that worsens his hypertension is that he's a police officer in a high crime neighborhood. This can potentiate that he is frequently in the fight and flight state within his body, keeping his blood pressure raised in his occupation. Even just going to his job daily. Maybe he's just, as soon as he gets in his car, his police cruiser, he is immediately high heart rate, high blood pressure. So his profession definitely has a high factor for the fact that he is frequently in that fight and flight stage. So also kind of associated with that, our stressful habits are associated with drinking, tobacco use, and eating more. So, with that stressful habit of his profession, what does he do when he goes home? And in his H&P, it says that he drinks about 5 alcoholic beverages when he goes out daily. So, and that is another lifestyle factor that is a contribution to increased hypertension. So that is something else we would need to address as well, decreasing his alcohol consumption and down to maybe 1 time a week or 2 times a week, a drink a day, and also exchanging alcohol with healthier options such as water. So, and the aspect of his dietary, it states that he does not watch his sodium, fat, and carbohydrate intake, and that he had a 20-pound weight gain within a year. So my question would be that, what does his normal day of meals look like? Does he eat fast food frequently? Does he drink a lot of caffeine? So just kind of looking at, if he eats high fat meals and high sodium meals, those are obviously negative components to his increased risk for hypertension. So educating that we want to try to, instead of eating fast food during the job, try to pack our lunch, or even, having healthier options, salads over, fried foods, things like that too. But try to have a normal, or try to have a healthier, homemade meal is better, because there's definitely less sodium when you make it yourself and not from, preservative factors. So, also things like, does he drink caffeine? There might be a possibility that he does. That would increase our heart rate and our blood pressure as well. So, that would be something that we'd have to look at cutting back as well. So, obesity, in the aspect of his dietary and the 20-pound weight gain, I don't know what his baseline weight is right now, compared to, is he a healthy BMI or not? But obesity is a risk factor for hypertension, having more force of the heart to try to perfuse all of the tissue of the body, if it's extra tissue or not. So we just definitely want to educate, plenty of fruits and vegetables, plenty of protein, less salt, more water, less caffeine and alcoholic beverages. So the other thing that is associated with his weight gain and lifestyle habits is his physical inactivity. It does say that he does activity related to work, but typically that's not enough. So outside of work, doing things like walking 30 minutes daily, that will definitely help kind of just increase the exercise and moving that his body needs. So while, he is living a very, very high risk lifestyle to developing that complicated hypertension, since he already has undiagnosed hypertension, with his family history, occupation, diet, stress, or exercise and everything. So that is he definitely needs a lot of adjusting in his life to help change, so he doesn't get to that complicated level of hypertension and end up having organ damage. So there, when it comes to pathological, explaining to him of what can happen, the one that I wanted to focus on the more is heart failure. So hypertensive heart disease is responsible for about 1/4 of all causes of heart failure. And heart disease related hypertension affects the heart by changes in the left ventricle, left atrium, and coronary arteries. There's that remodeling and reshaping, and a negative effect. And overall, it just increases the workload on the heart and just creating a negative effect. Basically, what can Mr. Jones do to help the complications for changing? So he doesn't develop this complicated hypertension? Kind of like I said previously, his diet, increase potassium intake, focus on fruits and vegetables and proteins, increases exercise, decreases alcohol intake, and focus on switching to healthier alternatives, like water. Also, when it comes to his occupation, not necessarily needing to change his occupation, but if he does get to a stage of his hypertension that it is damaging his body, he'll probably need to step back into a less stressful occupation. But as long as he gets a hold of all the other things related, to his hypertension, and he, is decreasing it and is able to manage it appropriately, then he should be able to maintain his profession that he's in. But if he maintains his profession, finding decompressing measures such as meditation after work, or yoga or stretching to help reduce stress levels after work. So ultimately, we just want to try to decrease his overall stress and just create a healthier lifestyle for him, for a longer life for him. So definitely a lot of changes Mr. Jones does need to make. So.